Not very often that a patient has the opportunity to put a face to a disease. And it's not very often that a patient has the opportunity to educate doctors. Hi, my name is Becky Strong, and I would like to tell you a little bit about my path to diagnosis with Pemphigus vulgaris and how it has affected my life and the lives of those around me. Pemphigus and Pemphigoid are rare autoimmune blistering diseases where your body thinks the cells that hold your skin together are the enemy and attacks these cells. My journey with Pemphigus began back in September of 2008. I started getting these water blisters in my mouth, but I had been eating a lot of spicy foods and a lot of acidic foods. I could wipe my tongue across these water blisters and they would go away really easily, so I didn't think much about it. I was also getting nosebleeds at that time, but I could explain those away too. I had really bad allergies. About 4 months later, my husband and I got married. We had a wonderful wedding and went on our honeymoon, and I started to get these water blisters in my mouth again, and even a couple canker sores. But I just figured it was due to all the tropical drinks with the little umbrellas in them. Everything was fine again until September of 2009. That's when these water blisters appeared in my mouth. I could again scrape my tongue across them and had no problem getting rid of them. But they never completely went away. And by the end of the month, they turned into canker sores. In October, I had my 6-month checkup with my dentist. I told her at that appointment about these water blisters, and that's when she told me I had bad oral hygiene and I needed to brush more. By November, I started looking things up in the internet with my husband. We had about a working list of about 8 things of what we thought it could be, and I made an appointment with my gastroenterologist because I thought I had Crohn's. When he looked into my mouth, he cringed. His physician assistant came into the room, and when she looked into my mouth, she cringed too. I appreciate the care that a lot of doctors have given me, but I've noticed that along the way that sometimes doctors would get wrapped up in the area that they are treating, like my mouth, and sometimes forget that there's a whole patient wrapped around that mouth. Together with my gastroenterologist, they decided to prescribe a mouthwash with Decadron, Maalox, and lidocaine in it. I was told to swish it around in my mouth 3 times a day for 10 days. Don't swallow it and don't rinse it out. I used the mouthwash every day as instructed, and it made my mouth so much better. But when I stopped using it, the sores in my mouth came back worse than they ever had been before. Thanksgiving that year was a rough one for our family. Before dinner that day, I went into the bathroom and I scraped the scabs off my mouth so I could eat. When I sat down for dinner, I had maybe a couple bites of turkey, a couple bites of corn, and a bite of mashed potatoes that turned pink when I took my fork out of my mouth. In December, I went back to my dentist. I had mouth lesions now all over, on my tongue, on my cheeks, on my gums. I told my dentist about the medicine that my gastroenterologist prescribed with the Decadron in it, and asked her to refill that prescription. She said it was a lot of steroids for somebody to be on, and instead prescribed an alcohol-based PerioGard. I was brushing 7 times a day, but it was about this time when I stopped being able to turn on my electric toothbrush. I pretty much cried all the time now, and I even learned to eat meat whole. And I also learned to start babying my mouth. I'm not talking to you like this back then. I would have been talking to you like this because my mouth hurt so bad. Then my husband and I went back to our research on the internet, trying to figure out what was wrong with me. We started looking at articles and different websites and even started looking at images. And for the first time, I started to get really scared. Looking at those pictures, I thought I had AIDS. By January of 2010, I went back to my dentist. My mouth was really sore. I asked her who I should go and see, whether I should see an ear, nose, and throat doctor, a periodontist, or anybody else who could help me. She told me it was idiopathic and just something that I'd have to learn to live with. My mouth was so sore. I was so sensitive to heat, cold, texture, anything that had to do with food. I pretty much swore off all solid foods by this point. I was surviving pretty much on water and Slurpees. And I'd also lost 20 pounds since the fall. By the end of that month, my husband had had enough. He had made me a bowl of whipped potatoes that were probably more milk than they were potatoes. I'd put 1 spoon in my mouth, and my mouth started bleeding. That's when he made an appointment with his internist. I took with me about a 4-page history of anything that I thought could contribute to my issues. Anything from home renovations to trips that I took, and even a very complete medical history. I explained everything to her, how my symptoms started, what made it better, what made it worse. And at the end, I just started crying. And I told her that even if she didn't know what was wrong, I just really appreciated that she listened to me. She ran a whole gamut of blood work. And when my results came back, a blood test that marks for autoimmune disease came back positive, but she couldn't quite figure out the mouth lesions. So she wanted me to see an oral surgeon. And I made an appointment. I went in for my appointment, and a resident came into the room, asked me a whole bunch of questions, and I even gave him my 4-page history. He said he would be back with his attending. He came back with his attending and about 7 others. His attending grabbed my mouth, and when he did, he grabbed a scab, and of course the skin fell off and my mouth bled. He apologized, but he grabbed my mouth again. There were times when people looked inside my mouth and would grimace. I'm sure they thought they were being sympathetic, but what it really did was make me feel disgusting when I really needed compassion. When the resident came in, he said that they had narrowed it down to a list of 3 possible things: Pemphigus vulgaris, Pemphigoid, and lichen planus. They said that they wanted to do a biopsy, and on my way out I could stop at the desk and make an appointment for that biopsy. And that's when I pretty much lost my mind. I started crying uncontrollably, begging him to do that biopsy today. I couldn't go on living like that, and I was really desperate. I even took my credit cards and my wallet out and my checkbook, and I told him that it didn't matter what it took. I needed that biopsy today. He said he would see what he could do and left the room. When he came back, he said that the attending agreed that they could do the biopsy today. A week later, I went back to the oral surgery clinic to get my results, and they said that the immunofluorescent test came back positive and that I had Pemphigus vulgaris. They also told me I needed to see a dermatologist. I was so desperate at that point, I would have seen anybody. And if it took going to a dermatologist to get help, then that's what I would do. February 16th, 2010, I had an appointment with my dermatologist, and I got the most complete physical exam that I've ever had in my whole life from a dermatologist, 2 residents, and 3 med students. They discussed what Pemphigus vulgaris is and gave me a lot of information, most of which I was so overwhelmed with that I don't remember. They talked about the side effects from the medications they were going to put me on and ended up putting me on 80 milligrams of prednisone and 1.5 grams of Cellcept twice a day. Within about a month, I started to notice that I had the classic steroid moon face to the point where I almost didn't recognize myself. My behavior became a little different at home too. I started cleaning at weird hours of the night and would get weird bursts of energy during different times in the day. I started to talk really fast. And when I say really fast, I mean really fast. I mean like even faster than this even. It was about that time that I went back to my dermatologist for a checkup. I told him that since he specializes in these kind of diseases like the one that I had, there must be a support group for people like me. And he said he really didn't know of one. So I went back to my trusty friend, the internet. And that's when I found the International Pemphigus and Pemphigoid Foundation. It's a fabulous organization, and it provides a lot of information for patients and patients' family, but also to healthcare professionals. They had great tips on diets and keeping journals about foods and other activities that might upset my disease. I was really amazed to even find somebody that they call a peer health coach. It was somebody who had walked in my shoes a long time before me and kind of knew the road that I was traveling. That's when I found out that they were having a meeting in Philadelphia for patients and doctors. In May, we went to Philadelphia, and it was a wonderful experience to get to network with other patients and to find out that I wasn't alone in all of this. I guess one of the most amazing things that I realized along my journey is how much I felt more relaxed and at ease after getting a diagnosis, knowing that the oral surgeons and the dentists in the oral surgery clinic and my dermatologist had this under control. They had such a confidence in my treatment that it made me relax and know that I was in excellent hands, that they had seen this before and that I wasn't alone in this, that we were going to work together as a partnership to get me better. In closing, I encourage you to keep learning about this disease and sharing what you know with others. After everything, I'm hopeful that by sharing my story, I can help other patients be diagnosed in less time than I was by having to see fewer doctors. The more we know, the faster we can diagnose and treat those in need. If you would like more information on pemphigus or pemphigoid, or wonder what you can do to help spread awareness, please visit www.pemphigus.org.